Hey guys, one of the most reputable resources for online health is actually something that's called Healthline. They got a lot of great articles from a range of topics. They actually happen to have one on penis stretching. And so today we're going to tackle this, see if it's fact, if it's crap, and basically what we can learn from it and take away from it. And so I happened to find this actually in my house. My brother got it when he traveled to Spain. So it is a new look for me, so stay tuned and let's go through this. And hopefully it sheds some light on this information. And so we're basically going to be starting using this this article. It's called "Does Penis Stretching Work?" The link will be down below, and I'll be putting up screenshots as we go along here. So if you want to follow along with me, I suggest you do, or just go read the article yourself. It's actually, overall pretty well done, but we'll talk about that. So first of all, they start with saying basically penis stretching involves using a device or exercises to increase the length or girth of the penis. Though this may temporarily increase the size of the penis, it's also associated with several risks. That's a pretty good intro. I disagree with the whole temporary thing. That's another video for another day, but let's just keep going. Let's not delay too much. So what is penis stretching? So it refers to using your hand or device to increase the length or girth of your penis. Although there's evidence to suggest that stretching can increase your size, the results are normally minimal. So this is where I start to disagree with it, because even in this article alone, they mention several articles that actually state that you can have a length increase of 2/3 to up to 1 inch. And so are they calling that minimal? Because they literally reference that later on in this journal article. And so I don't think that's minimal. I mean, when I was going through this, I would have been more than happy with actually 1/4 of an inch. That was my goal when I started this. I don't appreciate that. And then they say it may be temporary. I mean, at least they say it's may. These absolutely can be permanent if done correctly and if done for a long enough duration. And so they also say to basically set realistic expectations and make sure you use safe stretching techniques to make sure you do it safely. Of course, I agree with that. And so how does penis stretching work? They say it's important to remember that much of the evidence is anecdotal. Yes, there is a lot of anecdotal evidence, as you will see on these boards, but there's also a lot of actually peer-reviewed journal articles showing that this works. And I don't know why they're going to say that and then list several articles below, but let's keep going, okay? So, manual stretching. So, this is where it gets kind of weird. Manual stretching involves exercises using your hands to massage the tissue along the length of your penis. This is intended to stretch the skin and create micro tears in the tissue. These tissue may appear engorged as they heal, making your penis look longer. I kind of get where they're coming from with that, but overall, I disagree with that. First of all, manual stretching is stretching. It's not massaging the tissue. It's literally pulling and holding on the tissue to enlarge and stretch the tissue. The tissue doesn't really appear to be engorged as it heals when you're talking about stretching. If anything, sometimes you can almost get like a turtling response afterwards. So I don't think that in itself makes it look longer. Sure, if you put a good stretch on it, you can have a little bit of a longer flaccid hang, but I disagree with that. Then they go on to say some exercises claim to increase girth, such as jelqing, are centered around tissue massage. Once again, I would argue the point massage. I would argue nobody should jelq, but they do have a separate highlight, where you can click on to learn more about jelqing. But it's not massaging. It's trapping that blood and forcing that tissue to engorge beyond its normal limits. And so consistency is the key. Absolutely agree with that. So then it talks about stretching devices. Well, although researchers have studied penile extension devices, it's still unclear how well they might work. All of the published evidence that I've found using extenders has shown unequivocally that there is an enlargement process that occurs. And so I would disagree with that. There's clear evidence of that. Then they say, well, take a penis pump, for example. Well, a penis pump is not a stretching device. If anything, it's a device more for girth, but in this case, they're talking about the actual penis device used for erectile dysfunction. And so when you have erectile dysfunction, you use a penis pump completely differently. When you have erectile dysfunction, you put your dick in the device, then you pump it up, okay? And then you actually engorge that tissue, and then you put a ring around the base to keep that blood trapped in there. When that happens, it's not actually part of an enlargement or a stretching technique, and that's what they go on to describe. They're using inaccurate information right there. And so they also say penile traction devices are also popular. The device pulls on your penis to modify its curvature. Well, you can use it to modify its curvature. Most of the published literature on it is to modify curvature, but there's published literature just saying, hey, if you put it on, pull it straight ahead, you're still going to get an enlargement that way. And so they say traction devices have been used to treat Peyronie's disease, but more research is needed to determine how effective they are. Well, this is where I also have a problem with what they're talking about, because when they talk about what the research says, they say that, research on penis technique is limited, and none of the studies that have been done point to any one technique as an effective way to permanently lengthen the penis. However, a temporary increase in size may be possible. So there are studies. There's even a urologist, an actual MD urologist, I forgot her name, but she is actually on YouTube and says in her video, extenders work. Extenders work to increase length. You have to use them for a long time, but there's published literature that shows that they work. They do mention this study, which I've touched on before, and I'll put up a little blurb here showing that you can gain basically 2/3 of an inch. But once again, this is published literature. It's not just like some anecdotal story. And then part of my problem is they say that there's limited research when it comes to Peyronie's disease. But if anything, that's where most of the data is showing enlargement. And I kind of extrapolate from some of these studies, which is a limitation. It's a completely different population. But there's a study like this, a study like this, a study like this, and a study like this that all show that you have enlargement when you use an extender when it comes to Peyronie's disease. Some of them show that with contributing of like correction of the curve. Some of these papers actually show it just lengthens even if you don't have correction of the curve. I don't understand why they are being kind of hypocritical and going back and forth with this literature. And then one of the big things with like research is, they list some other studies where, 2011 study where a 3-month gained up to an inch in length. But then they list like 2 more crappy studies that don't show that there was like length involvement. But there's all these other studies that I just pointed to, and often the ones they're researching are about actual like extenders when it comes to Peyronie's disease. So there's this paper here titled "The Effect of Penile Extender Devices in Increasing Male Penis Size in Men with Shortened Penis. Preliminary Results." Yes, I get it, preliminary results, but this was published in 2011, and it's a really good study showing that you had a significant increase in length with just the use of an extender device in a patient population that is not Peyronie's disease. Like, why would they not include this if this is a doctor-reviewed literature article? So it's just something to think about, guys. And then, of course, and I've mentioned this before, which I wish they mentioned this study, but macropenis, megalophallus. I made a whole video about it, which you can see here if you want more. I'll put a link in the description. But there's literally this phenomenon where you basically have this ischemic priapism, is what we call it, from like sickle cell disease, where you get blood trapped in the penis and it engorges, and it can literally lead to a chronic dilation of the tunica, and you can have permanent penis enlargement. And in this paper, which I'll put up here, they actually go through the data about it and actually go through the actual surgical correction that you need to have, because the tunica dilates in almost like an aneurysmal type dilation, and it leads to pathologically enlarged penis that are literally so big that you can't even have sex with it. So there's a lot of data that they failed to mention, which I don't appreciate, especially when they're talking about there's limited data. And some of this data, like in the video that I made before, showing like, oh, you do these 2 techniques in order to get permanent gains, they showed that the guys who did this technique continued to have permanent enlargement even up to 6 months after stopping all types of enlargement exercises. So there is evidence of permanent enlargement. I do love that they focus on safety here, because obviously that's like how I came onto the scene, was I was all about safety. They say that, there is generally no harm in trying stretching exercises. It might help you feel more comfortable, but there, it can be dangerous. And so then they give their stretching exercises. And so before doing anything, only do it when you're flaccid, stop if it causes pain, sit or stand against the wall or a table when you're doing them to stabilize yourself so you don't fall. Only do these exercises once or twice a day to avoid injury, and then talk to your doctor if you want to hold these exercises longer or do them more frequently. So 4 out of 5 of those I agree with. Talking to your doctor, like, can you imagine going to your primary care doctor and being like, hey doctor, I want to do more penis enlargement exercises. What do you think about that? They're going to look at you like you're crazy and laugh you out the room. So I appreciate them recommending you talk to your doctor. Maybe certain urologists that are familiar with this data, yeah. But in general, most urologists, most doctors are not going to be familiar with this. When they talk about actually how to do it, they say basically grip the head of your penis. Wrong. You never want to grip the head of your penis. You want to grip just below the head of your penis, because, so let's say this is like your penis here. This is the glands, the head of the penis, okay? You never want to grab right at here. You want to grab just back here so you don't actually put pressure on the glands. You can actually separate your glands that way, or you can cause permanent damage, nerve damage, especially that way. So it says pull your penis upward, stretching it for 10 seconds, then release, then to the left, then release, then to the right, and then repeat these steps twice a day for about 5 minutes in 10-second intervals. It's not going to be enough stimulus to cause growth. So I actually was looking at this when I first started, and I was like, oh, okay, I'll try this. And, stretching it for 10 seconds and relaxing lightly, you're not going to get any permanent gains that way. So of course, they're going to say, oh, temporary enlargement, but nothing permanent. You're like, yeah, when you do it this way, you need to do it longer. And so guys, I am going to be making a full video. I'm going to try to make it safe for work so you can actually view it on YouTube on basically how I do manual stretches and exactly what my routine is. But this ain't it, Chief. You need to have a longer duration. So then they also give a similar derivation of this where you basically do the same stretches, but you just keep a hand at the base and you grip here and then pull, pull and then pull in these different directions, which I think is a good base to start with, but you're going to need more than that. Then they talk about jelking, where they say, put your index finger and thumb in an O shape, and then, make that gesture at the base of your penis, and then make the O smaller until you put mild pressure on your penile shaft and slowly move up and down the shaft. I mean, that's a pretty good description of a jelk. I don't recommend anybody jelks. I think it's kind of almost malpractice, but whatever the equivalent of that would be, putting that information out there to say, oh yeah, you should try jelking. You shouldn't do it. It's going to break your dick. Most of my clients for injury coaching, they've broken their dick from jelking. Then it says stretching with a device. Once again, you're not using a device. You're not using a penis pump for stretching. And once again, they describe this technique where you use it to actually get an erection, and so then you can actually put a ring like on the base of your penis to trap that blood in there and maintain an erection that way. It's just not, it's not applicable to actually enlargement exercises. And then the use of a traction device, that's pretty solid. But there's not too much to that. They just said leave the penis in a stretch position for 46 hours a day. But what they don't say is that you really need to be taking breaks in between there, allow the tissue to revascularize. I would say at the very least every 30 minutes. Yeah, that's solid advice. But in general, make sure you take breaks. Speaking of taking a break, guys, if you see me in this get up or in this location, it means that I'm at home and it's at night. Hopefully I get lucky again tonight, but guys, I take this Vigor anyways. If you haven't seen my videos on why you need citrulline, you should really check it out, and especially why specifically this formula. This formula has science-based, and it is used to not only increase your nitric oxide, but your nitric oxide synthase and your nitric oxide precursors, in addition to a more bioavailable form of arginase to actually combine with the citrulline to get better results. So this is literally backed by science, guys. If you haven't seen my video, please check out my video on what you should look for in a PE supplement, basically, okay? But I take this to increase my blood flow at night, help with recovery. It's amazing for workouts, and of course, when it comes time for game time, with my significant other, I like this in my system because I can go very hard in the paint if you get my drift. So it's dry scoop season again. And guys, I don't even have to take a full scoop for this to be maximally effective. I only take about a half scoop and I'm good. Oh yeah. And I actually like the taste, but that's my preference. Anyways, back to the regularly scheduled programming. So then the potential risk and complications. They basically say that you can cause large tears in the tissue or damage the ligaments that connect your penis to your body. Yes and no. In general, you're not going to cause a actual penile fracture. So you're not going to actually fracture the tunica. And in general, yeah, you can have some ligament strain. But the thing that most people don't understand about the penile ligament is even if you were to sever it, you were to go really hard manual stretching and you pull it off or you separate it, the ligament will actually reattach. That's why with these penis enlargement surgeries where they actually ligate that ligament, it actually can reattach if you're not careful, and so it negates itself. So actually permanent damage to that ligament, I think, is a pretty low risk. Now, can damage the nerve bundles and the vasculature in that area. That's part of the reason why you can get hard flaccid. If you haven't seen my video on hard flaccid, you should check it out. But I just don't worry about my ligaments when I'm doing this. Stretching exercises may include itching, minor bruising, discoloration, red spots, numbness, vein rupture. You're probably not going to rupture a dorsal vein just doing some manual stretches. It usually takes much more stimulus to cause that. I get why they put it in there, but I think what you're more likely to have is some potential numbness, some potential pain in like the ligament area, the suspensory ligament, pubic pain, depending on how you do it and like where you hold, you could even have some pain in your testicles, temporary numbness, if I didn't already say that. Those types of things are more common when you're talking about stretches, and maybe even some decreased erection quality, which they don't mention here, but that's one of the bigger indicators that, you need to take a break and you need to back off is, erection quality issues. They do recommend you see your doctor if your symptoms last for more than a couple days or they are severe. Yeah, I mean, that's definitely sound advice. And so I think if you're concerned about anything, go see a doctor. Once again, the problem is a lot of doctors don't know shit about this. So just make sure that your doctor is up to date, or you bring some literature with you so you can say, this is what I think is going on, this is what I'm doing, so they actually know how to counsel you. Then it says, seek immediate attention if you experience sudden painful loss of erection, swelling, or major bruising. Yeah, duh, of course. Or if you just get concerned, go seek immediate attention, okay? And so when will I see results? Well, they say that the results will depend on the approach you take, how consistent you are with it, and basically if you're using devices and how often. And so I agree with that. The key to getting permanent results is making sure you have an effective technique and for doing it for a consistent enough duration, because in my opinion, you're talking about 6 to 8 weeks before you can actually see results, okay? So they say, bottom line, if you have any questions concerning your penis size, talk to your doctor. And so I would add to this, like, you really need to learn what is average statistic. And so the average penis size is not like 6 or even 7 inches. It's around like, 5 to 5.5 inches, around in there, generally speaking. If you actually learn what average is and you're not watching porn and you learn normal size statistics, you can actually, you might not need to even do any kind of enlargement techniques whatsoever, but they do recommend you do it safely and, follow the guidelines, discuss it with your doctor. Your doctor's not going to go know shit about penis enlargement unless I happen to be your doctor, which you don't want to be seeing me, trust me. But that's due to the nature of what I do. Anyways, guys, hopefully this was helpful. I thought this was overall a good article. This is a major health outlet, and it talks about, a pretty taboo topic of penis enlargement, and it actually says that in a lot of ways it's legit. And so I think they have a little bit of misinformation, some stuff that I would do differently, but overall, I was pretty pleased with this article. Hopefully this helped, guys. If you need to reach me, I'm available on my Patreon, Doc Inc. If you want to just support me, you can also go through my Patreon. Vigor is going to be back in stock this upcoming Friday, which will be, let's see, it's the 16th, so the 17th. Tomorrow it'll be back in stock. And so you guys look for that February the 17th if you guys are watching this in the future. Anyways, guys, until next time, do your own research, form your own conclusions. Peace.